Hi, my name is Nat and I work with PACOP. Today on PACOP Clinical Bites, we are looking at the Profile three-part clinical assessment form. The profile collection has three clinical tools. There is the admission and discharge details form. There is the three-part clinical assessment tool, which we are looking at today. And there is the deteriorating resident tool. The three-part clinical assessment tool has three parts. Part A is face-to-face clinical assessment. Part B is the desktop assessment. Part C is the action plan. This clinical assessment tool should be completed for every resident every 3 months. Part A of the clinical assessment form is the face-to-face assessment. To complete this section, you will need to attend the resident to be able to get this information. It includes the 5 PACOP assessment tools, which is the SAS, the Problem Severity Score, the Australian Modified Karnofsky Scale, the RUG ADL, and the Rockwood Clinical Frailty Scale. There is also 3 questions at the end to do with communication and psychosocial. Go and see the resident. Complete all 5 assessment tools if you know the resident. Remember, when you're assessing the SAS, what you are doing is asking the resident for their level of distress in relation to those symptoms. It is best to do this as part of a conversation with the resident. That is how you will get the most accurate and helpful information from the resident. And finally, complete the 3 questions in the communication and psychosocial section at the end of Part A. Part B. This is called the desktop assessment because you do not need to be with the resident to do this. You can do this away from the resident, back in the office, or wherever you need to be. Reason for care. This is the first question. Tick one option for every line in this section. You will see in the 3 columns there will be this is the main reason the resident needs care, or this is a reason but not the main reason the resident needs care, and finally this is not a reason that the resident needs care. For the first column, there can only be one tick in this column. There can only be one main reason. Every other line has to have a tick in either column number 2 or column number 3. Advanced care planning and decision making. This is addressed in this part B of the desktop assessment. Remember, handy hint, if the answer is no or you don't know, consider putting that in the action plan at the end. It also has information about recent hospital use, unplanned and planned admissions, and there is also a box for you to put in the ANAT class if you are known. That's part B finished. Simple, quick, easy. Now we're on to the action plan. The action plan is very easy to fill in because it is a series of boxes, either yes or no. That will then guide you as to your actions needed, which is in the bottom half of the form. So first of all, in the top section, identifying the need for palliative care. For each of these statements or questions, tick yes or tick no. Then go to the bottom of that and it says, if yes to any, resident would benefit from palliative care. If you are doing the outcomes collection, that would be when you would progress to the outcomes collection. However, if you were doing the profile collection only, this would be when you would follow your normal protocols and processes for palliative care for a resident. If no to all of the questions, continue to monitor using the PACOP profile collection. That is every 3 months, or if concerned about a resident, you can use the deteriorating resident tool. We then move down to the actions, which is the bottom half of the form. You'll see the first box is no action required. Continue to monitor using the PACOP profile collection. Under that are a list of options for actions required. The first one will be internal aged care home action required, and there is a list. And the second half is requires external referral to address care needs, and then there's a list. Document your plan, make sure you hand over to your team, and you're done. Thanks for watching this PACOP Clinical Bite. If you need any further information about this form or anything else to do with the profile collection, please go to our website or contact any of the improvement facilitators and we'd be more than happy to help. Thanks for watching.